Hey everybody, and welcome back to another episode of Mind Matters, Navigating Head Injuries and Concussions. I'm Kylie Como. I'm the legal nurse consultant here at Shane Smith Law, and today I'm joined again by our friend Dr. Robert Bashut, the medical director and lead neurologist at the Neuroscience Specialty Centers. Dr. Bashut, it's always good to be with you. Good to see you.
Great to see you again and ready to go.
All right. Well, again, as everybody knows, we here at Mind Matters love to talk about all things traumatic brain injury. And so I hope you're able to go back and join us for part one of Dr. Concussion. We're going to kind of continue where we left off with that one today and get into the lymphatic system. So, Dr. Bashut, I'll let you take it away.
We discussed adult hippocampal neurogenesis in the previous podcast, and this is very much related to that, but this is really more focused on the lymphatic system. I did mention the lymphatic system in part one, but we're going to kind of cone down on exactly what the lymphatic system is, because most people actually have never heard of it. So the lymphatic system was not discovered until actually 2012. And the lymphatic system is the waste removal system in the brain. And again, we were not aware of this before 2012. Where does this term come from? So it comes from glia, which these are cells in the brain. These are not the neurons. And then it comes from the lymphatic system. So the lymphatic system in your body is important for getting rid of debris, things that you don't want. But there's no lymphatic system in the brain. But we do now know that there's a lymphatic system. And so the lymphatic system is basically adjacent to small arteries in the brain. And there are heart pulsations from your heart. They're transmitted to these small arteries in the brain, and they're responsible for moving cerebral spinal fluid, CSF, movement through the parenchyma of the brain. The parenchyma is the brain substance. So the heart beats, the pulsations are transmitted in these small arteries, and this pulsation actually pushes spinal fluid, which surrounds the arteries, through the brain into the veins. So this is kind of a picture of it here. It's pretty busy, but this is your artery here, okay? And this is the wall of the artery. This is the space adjacent to the artery that contains spinal fluid. We call it the periarterial space. Okay, and here are the glial cells right here, and they form what's called the blood-brain barrier. As these arteries pulsate, that pulsation is transmitted into this space here. It pushes the cerebral spinal fluid out. It goes this way. The purple stuff you see here is cellular debris, amyloid and tau. We're going to talk about those two guys in a second. But as the arteries pulsate, then it pulsates adjacent to the spinal fluid. The spinal fluid is pushed out of these spaces, and as it is pushed this way, it picks up this debris and it goes back into the CSF again, the spinal fluid, and into the vein, and then that is then released to the main venous system, and it's excreted from the body. So this is what is known as the lymphatic system. So here's another picture, and during sleep is when the lymphatic system works. Okay, I want you to see these arrows here and these arrows here. There's a big difference in size. Also look here at the size of this neuron and here. So basically during sleep, what happens is this CSF, the spinal fluid adjacent to this artery, is pushed this way, and it picks up debris, and that debris is taken into the cerebral spinal fluid adjacent to the vein. It goes into the vein, and it's excreted from the body. And this happens during sleep. And if you notice that the neurons, I'm not going to say they're turned off, but they're not working nearly as hard as when you're awake. All this debris that occurs during the day is picked up by the lymphatic system, and it is transmitted into the veins and is excreted. And that happens when you're sleeping. And again, the neurons are not working very much while you're asleep. But when you're awake, the neuron is activated. You're learning. You're learning about Zea mazaverta, what popcorn is. Okay, those neurons are active. But the lymphatic system, the spinal fluid that is adjacent to this artery going into the brain parenchyma, not much is going on. 90% of lymphatic system activity occurs when you're asleep. So think about that for a second. If during the day your neurons are very active, but there's a lot of debris that's built up, what happens if you don't go to sleep? You don't get rid of that debris, and the brain does not like that. Okay, it's just like today or yesterday was trash day. So the guys came and they picked up the trash. Well, what if they didn't pick up the trash? The trash is going to build up, and it's going to, it's going to make your front yard look terrible. Okay, so 90% of the activity of the lymphatic system occurs during sleep. What happens with concussion? These people have trouble sleeping. So at night when you're asleep, your lymphatic system, it removes the debris. The neurons are quiet, but the trash collection is ramped up at night. Once the trash, the amyloid and tau, is removed from the neurons are clean, they're fresh, and they're ready to learn for the day. It's trash collection. So think about how you feel the next day if you're not able to sleep for 24 hours. You feel like you had a concussion. You're irritable. You can't remember things. You're frustrated. You feel terrible. You have brain fog. Sleep dysfunction is a major complaint after concussion for many different reasons. Musculoskeletal injury, post-traumatic headaches, anxiety, autonomic nervous system dysfunction, just to name a few. When there's lymphatic system dysfunction, there's disrupted removal from the brain of many different chemical compounds, including tau and beta amyloid. And everybody remembers, or a lot of people remember, in the hippocampus, that's important for memory. We already talked about that, but beta amyloid and tau build up in the brain of people who have Alzheimer's disease. So the amount of beta amyloid in the brain parenchyma may double if you go 24 hours without sleep. So you better sleep because you got to get rid of that stuff. So as we age, there's a gradual lymphatic system dysfunction. There's a decline in slow wave sleep, which is needed for proper lymphatic function. So can this be a contributor to the development of neurodegenerative disorders? So this is kind of how I got into all this. It's all related to concussion, but it's all related to something probably a whole lot bigger. Lymphatic function improves with exercise, okay? Aerobic exercise, the Buffalo Concussion Treadmill Test. It improves if you have a good omega-3, a good vitamin D, a good B12, a good diet, and good sleep. That sounds really familiar. If you guys watch part 1, you heard all of this already. These are the things we do to help resolve concussion symptoms and improve adult hippocampal neurogenesis. So the lymphatic function declines with age, stress, traumatic brain injury, and stroke. So remember, TBI can be mild, moderate, or severe, and concussion is also known as a mild traumatic brain injury, even though that's what it's called, a lot of times it's not really mild. With the decline in the lymphatic function, there's a buildup in the fluid of the brain of these inflammatory neuroproteins, tau and amyloid. And if you have a decline in lymphatic function, that leads to neuroinflammation. And it's a vicious circle. The more neuroinflammation, the more difficulty with sleep. The more difficulty with sleep, the more tau and amyloid build up. So this results in damage to neurons and the glial cells, which we think leads to neurodegenerative disorders such as Alzheimer's, Parkinson's, Lewy body dementia, and frontotemporal dementia. So preserving lymphatic function, again, exercise, good sleep, a healthy diet. I like my B12 above 400. I like my omega-3 above 5.4. I like my vitamin D above 40. And the reason I say that is because most labs, vitamin D normal is 30 to 100. B12, it's usually like 230 to 1200. But I like my B12 above 400 and my vitamin D above 40. And I think these blood levels should be part of routine blood work once or twice a year, and more frequently if they're abnormal. And again, I asked this in part one, and I'm going to come right back to it. Can you prevent, delay the onset, or reduce the severity of neurodegenerative diseases by improving adult hippocampal neurogenesis, the lymphatic system, and reducing neuroinflammation? And I think the answer is yes. So the last thought, can having a concussion in a very, very strange way actually end up being beneficial in the long run by improving lifestyle changes that will improve and prolong your quality of life? So another example of this is, let's say there's a 50-year-old individual who doesn't exercise, overweight, he has diabetes, his cholesterol is really high, he has a small heart attack, and he changes his life. He starts exercising, he controls his blood pressure, he lowers his cholesterol, and he lives another 40 years, okay? Again, nobody wants to have a heart attack. Nobody wants to have a concussion. But sometimes, and again, in a strange way, it can change your lifestyle, and that actually will improve your quality of life. Thank you very much.
Thank you. Always fascinating getting to talk to you. I would like to dig a little deeper, though. I especially love the graphic you put up, the lymphatic system, the CSF channels, the depth you went into and how the CSF circulates. I think there may be some in our audience that aren't really as familiar with what cerebrospinal fluid is. You know, you kind of went into that a little bit. Could you talk a little bit more about what cerebrospinal fluid really is?
Sure. So CSF, or cerebrospinal fluid, this is made in something that's called the choroid plexus in the brain. And basically the fluid is produced and it circulates around the brain, and it provides a cushion. Okay, it's protection for the brain. It provides buoyancy for the brain, and there are a lot of important nutrients in cerebrospinal fluid that bathe the cells of the brain. You have about at any point a pint of spinal fluid circulating in the brain, and it's turned over 4 or 5 times per day. When you have, I will say this, if you hear somebody with meningitis, you get inflammation of the covering of the brain, and you'll find these white blood cells, these inflammatory cells in your spinal fluid.
Yeah, that meningeal inflammation, definitely dangerous. Those are always some sick patients. So I know people out there, and maybe some of our female listeners maybe have had that epidural, injection, or an epidural anesthetic block. So when you do a spinal tap, do you do those to ever diagnose? Do you pull off some of that cerebrospinal fluid and look for some of these markers?
So you can, yeah, absolutely. Okay. So if you're concerned, there are a lot of different reasons to do spinal taps. Okay. Again, obviously, if you think somebody has meningitis, so a lot of times we used to do it a lot if you're having cognitive symptoms. Mm-hmm. So there are many reasons to do. People with multiple sclerosis, we often look at their spinal fluid. So there's a lot of reasons to do that spinal tap. And you can look at protein, you can look at glucose, you can look at albumin. There's a lot of information you can get from doing a spinal tap.
I also liked how the lymphatic system being so newly discovered. I wasn't aware that it was only just discovered in 2012. That's pretty fascinating. But how you parse it out is the glia and the lymphatic system to make that lymphatic. So could you kind of walk our listeners through the differences between the lymphatic and the lymphatic system?
So again, the lymphatic system is only in the brain. Again, we think it has a lot to do with concussion and other neurological disorders like we talked about. I will say this, we are learning more and more about the lymphatic system every single day. The research on this is just exponential. And I think it's going to be a key to unraveling treatments and management of these disorders that we don't have great treatment for at this time. The lymphatic system is really the rest of the body. So you have lymphatics all up and down your extremities, in your chest, in your abdomen, And the lymphatic system is important to remove excess fluid. You know, a lot of women who, if they have breast cancer, or somebody has to have lymph nodes removed in the armpit and the axilla, sometimes they'll be left with swelling in the extremity on that side, known as lymphedema. So the lymphatic system is important for getting rid of excess fluid. It's important in the immune system by removing pathogens and debris. All that is done in the lymph nodes and the lymph fluid. And, you know, it gets rid of these pathogens that need to go. And so the lymphatic system is just in the brain. Lymphatic system is the rest of the body. But again, they both do something very similar, and they get rid of things that you need to get rid of. They haul the trash out.
Again, one of the reasons I like talking with you is that our audience, I think it's made up of a wide variety of listeners. We have, you know, clinical types, you know, providers, you know, nurses, you know, chiropractic doctors, but we have, you know, victims of these concussions. We have loved ones and family members. So the information you provide, you know, you give us clinicians, you know, some of that deep dive into some of the more scientific clinical aspects. But for our other audience members who maybe looking for, you know, what can we do about it? You give these actionable steps. You know, we talk about the diet, the things that we can do to prevent or to heal quicker from these injuries. So again, Dr. Bashik, it's always, yes.
Yeah, and I'm just going to say the people that I see, the complaints are so similar. And you know it is the result of neuroinflammation. You know they're not sleeping and the lymphatic system is not working. You know the memory issue is adult hippocampal neurogenesis dysfunction. And then you can see it get better. These people, their complaints are so consistent that you just know that's what's going on with these folks.
Yeah, 100%. And I love leaving it on a note. I kind of would wrap that up in hope. You know, there's hope for it. You know, you can diagnose it, you can understand it, and there are things that you, along with your patients, our clients, can do to get better, and get back to where they used to be, hopefully.
And not only can we do something about it now, but I think what's going to happen is in the future, there's going to be, and I don't think that future is that far away. I think there are going to be some really exciting things that we're going to be able to do to help people get better after a concussion. And could we prevent these neurodegenerative diseases? I think the future is actually very bright.
What a great way to end the episode. Thank you, Dr. Bashik. Amazing.
Thank you.
Well, everybody, that's going to do it for another episode of Mind Matters, Navigating Head Injuries and Concussions. Once again, I want to thank our guest and friend, Dr. Robert Bashik, for joining us today and sharing his expertise with us. Again, you can find Dr. Bashik and his team at the Neuroscience Specialty Centers in the greater Atlanta area, and you can also visit their website for more information on their services. I hope our audience has enjoyed this enlightening discussion today as much as I have, and I hope you're walking away with a deeper understanding and appreciation of the lymphatic system and other complex processes of the brain. Please don't forget to hit that like button, and if you would, please subscribe to our channel to keep up with our latest and greatest content. Leave us a comment. Let us know what you thought of our discussion today, and as always, please remember, if you're in pain, call Shane at 980-999-9999. Thanks.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.